Hey guys, welcome to another episode of the Optimal Health Radio. I'm here with Dr. Max Draper once again. We've done the podcast with Dave Lee talking about TRT, and Max and I have been speaking about we want to get some more information, some more industry insights about TRT, about testosterone, about men's health, and Max has agreed to come here and do some more episodes, do some more chats, and talk a little bit deeper into it. So Max, thanks for being here.
Pleasure. Thank you for having me back. Always enjoyed it last time. Yeah.
Yeah, it was good. It was good. I'm trying to get to Dave's level beard going on now, so I'm not quite there yet, but we'll leave it.
I've had a longer one before, but I've decided to end up trimming it more frequently. But yeah, he's got a decent beard on him. Yeah.
I just end up finding myself just twizzling things when I'm on calls, and it's a bit of an overload. Anyway, we digress. Since we spoke on the podcast, I've really been pushing men's health when it comes to my content on Instagram. And there's something that I've noticed a lot of, and I don't know whether you've seen this in the clinic, is that so many people are saying they're on TRT and it's not actual TRT doses. And they got high testosterone or this sort of things. What are your thoughts when we actually hear of people self-administering and they are very, very much not following guidelines?
Well, it is difficult because people, maybe rightly so, lost faith with the standard protocols out there. So, this sort of NHS 1,000 milligrams every 10 weeks, or the gels, or, basically these big bolus doses infrequently. So people lost faith with that system. And it can be really hard to get TRT prescribed, even if it seems appropriate to you and I. So people end up doing it a lot themselves. And the problem with the internet is that you have good material out there, good information, but you also have, bad information or not accurate information. So a lot of people end up listening to maybe one influencer, or they go on a Reddit site, and then they end up thinking that TRT is 200 milligrams a week. Maybe it's once a week, maybe it's split into two, or maybe 250 milligrams a week. And because someone on Reddit said that's a good starting dose, they assume that that's going to be appropriate for them. When in reality, there is quite a big variation in TRT doses between individuals, but also not a lot of guys need to go to often the levels that these people self-administering are. There's another thing that I think as well that happens, because I do speak to guys who are doing it themselves, and a lot of them end up with this constant, or at least nagging feeling or underlying anxiety that they're doing something wrong, or the stuff they're getting is not proper quality. And I think that sometimes has an impact as well that they don't quite appreciate, because you see a lot of guys come to you with a lot of anxiety when they're doing it themselves. And I think there's a little bit of a subconscious element there as well. So yeah, I don't know what you're seeing out there, but you do see a lot of kind of, I would say, high doses, and just overall lack of regular blood work, lack of confidence in the thing. Because obviously, if you're doing it yourself, then you're relying on you having all this knowledge that you frankly don't have. So I think it's a sad state of play, because a lot of people are going down that route when it's really not the best way to do it.
Yeah, and I think this is where we do have that optimal individual approach. And I have guys, as I say, I'm putting out so much content on testosterone. I put out my story about steroids the other day, and I was so scared of putting that story out, and I had so much love from it. It was amazing. And just talking about the mistakes of doing that stuff, doing cycles and things which require me now to use TRT, and how I didn't get blood work done. And I wish I did, because I had signs of low testosterone before I'd done anything, but now we will never know. And people are coming to me and they're saying, oh, I'm running this like 250 milligrams a week or every 2 weeks. It's the only option. And actually, I ask them, where are their bloods beforehand? They've not done their bloods. But there's also this, the doctors don't know what they're doing. Now, we've spoke about the system not being where it needs to be, the way the NHS manages TRT, pretty much a blanket test Nebido, 1 gram or 1,000 milligrams, as you say, every 10, 12, 16 weeks, whatever it is. But they're then blaming the doctors for not knowing what they're doing, but they're not doing the things that they should be doing in the first place. And that really, it frustrates me when people are saying that. because the doctors, as you've been a doctor, or you're a doctor, you've been a NHS doctor, and you're no doubt following a system. And you left that system, as you spoke about in the last podcast, because of the fact that you wanted to give a better service from your own experience and so forth. But then people are blaming things, and it's where it comes into self-responsibility as well, right? So we are blaming someone for something that we're getting frustrated with, and then just being hypocritical in ourselves and self-awareness. Now, getting back to the blood work side of things, you mentioned about anxiety. You mentioned about people self-administering and they're not knowing what they're actually potentially getting. I'm assuming that they're seeing their testosterone go up, so they must be getting some level of testosterone in there, unless it's this crazy placebo effect. But what else are you seeing on bloods when people are self-administering higher doses?
Yeah, well, quite a few findings. I mean, it's quite common findings if your TRT dose does go too high. I mean, sometimes if you're managed by a doctor, I've got patients who you'll change their dose, or you'll start at a certain dose and their levels will go, higher than you expect. So for me, like my personal experience, I'm quite a hyper responder to testosterone, I would say. Like I'm on cream now, but I was on injections. And when I was on injections for about 4.5 years, I was on about, I think, 100 milligrams a week, split up. And that's probably relatively low dose for the levels that I was achieving. But what you tend to see when guys are doing it themselves is, essentially like mini effects of taking a cycle, so a steroid cycle. So you tend to see, suppressed HDL cholesterol. You tend to see very high testosterone levels beyond what you would consider to be a level at which you would need to be to get symptom resolution. So they're taking more than you would need to take, essentially. Yeah. You might see, things that are classically associated with TRT, like particularly elevated hematocrits, so blood thickness. And generally speaking, the downstream effects, you can see like high prolactins, but generally what you're seeing is this level is beyond what they need for feeling better if the problem was testosterone, and B, kind of the downstream effects of what you would see if the hormonal system is really out of whack, because essentially they're just taking more than they would kind of ever require, and B, more than the body is happy with. And that's what's key is, that's why when you're monitoring bloods on TRT, it's not just about the testosterone level, it's a bit of an overall health check, but you're also kind of looking for hints that the body is content, that everything looks kind of nice and healthy, is everything's going in the right direction. And like you said, a big factor is a big miss that people are doing when they're doing TRT themselves is they're not getting baseline bloods, because you don't know if testosterone is the problem, because a lot of things can behave like low testosterone and you're just assuming it's testosterone and jabbing yourself and going from there. And two, you don't have a baseline to compare when you're on TRT to say, right, well, this looks abnormal, but what was it like before? Was it already a problem? Was there an underlying issue, for example, hemochromatosis, that was causing your low testosterone that you never found out because you never did the blood work? Because your blood on TRT can sometimes look a bit hemochromatosis-y, depending on your protocol and everything. But so you don't get that baseline look at your health before doing something quite major interventionally. That is the real missed data point, really.
I see as well, and this coming from the bodybuilding world, was then the overuse of aromatase inhibitors.
Oh yeah.
And then they're putting the numbers up high. And as we know, estrogen or estradiol, as it will come back on bloods, is just a response to what's happening in the body. But then trying to justify having these AIs and actually just crashing their estrogen.
Yeah.
Or their moods and everything else. Now, one thing I've noticed, and it is there's still been more overuse from when I've heard with some clinics. I haven't heard any stories of alphagenics, so you guys are the good guys here from everything that I've heard. But certain clinics, and I've actually been with a clinic in the past, I won't name any names of the clinics on there, but they wanted to then prescribe aromatase inhibitors because the estrogen was a little bit higher, rather than lower the dose a little bit or increase the frequency. but I really find it's worrying.
Yeah, and it goes back to that idea of having a sort of a fundamental understanding of the hormonal system and how things will look different when you're on TRT compared to not on TRT. You know, like you said, understanding where estrogen comes from, how it's created, what the blood level tells you. This is kind of a bit of frustration of my own as well, is that, you know, I like the way that people are getting into prescribing and monitoring TRT. I think it's great because more options out there means that men have more access to something which can be an incredible treatment option, something that's, you know, should really be more available and at least more wide known about. But I think a lot of people are getting into this business, like you said, naming no names, without doing that, getting that foundational understanding the fundamentals of, you know, your testosterone system, how that relates to estradiol, how it relates to all the other systems in your body. They kind of think, you know, high estrogen equals AI. This is because I've learned this, one flow chart that says high estrogen AI.
Yep.
And it's because we're not going deeper. We need to go deeper and understand, right, how is this being created? Is it actually abnormal for a man on TRT to have an estradiol level above the reference range? Because the reference ranges aren't for men on TRT. So it's kind of like this foundational understanding of the systems involved is often lacking. And again, that comes back to this idea about why men do get frustrated. And like you did, you know, someone tells you your estradiol is a little bit high, you should take an AI. And even you back then were thinking, well, actually, I don't think that's the right answer, you know? So it's kind of like, you know, so you're having to debate it with what you assume to be an expert. So it does get quite frustrating.
It gets frustrating, and you see the labs, and when you start hearing stories about certain labs, you can tell who have got the integrity, and that they aren't just there. Yes, the labs are all businesses. I'm running a business when it comes to the men's health work that I do. You're working in a business. That they're all businesses, so we do have to make money at the end of the day. But you can tell who are running with integrity because they're not getting told necessarily testosterone with HCG and loads of clomid and things like that on top of everything, and they're having a whole cocktail of drugs that then they're having to pay for each time for different doses of it, and they're not getting any symptom resolution either.
Yeah, yeah. Well, I think, yeah, it comes down to intent, and it's kind of like TRT on the face of it can be fairly simple, you know. And I think if you find that things are getting overcomplicated, like you said, you're going in and you're coming out with a shopping bag of medication, you've got to start questioning, right, do I need all of this, particularly from day one as well, you know, because logic would determine that if you're going on TRT, you probably, like, I'm a quite simplistic guy in the sense that I don't want to change like 5 variables at once in terms of medication. So if you're starting on several agents at the same time, just logic would dictate, you know, you're really muddying the water. So even when you start TRT, that in itself is a change to the body. So why don't we let that settle in first before, you know, if you want to take HCG, maybe consider that down the line, you know. And there's some crazy things like clomid with testosterone, which, you know, like we said before, doesn't really make sense. But yeah, I think if you're going in and coming out with a shopping bag, you've got to question the intentions there. And it is difficult because I think, like we said, is access through the NHS can be tough. It can be restrictive. They've got limited options treatment-wise. So then people are looking for the right answer. And like everything with the internet, it's confusing because there's, you know, several clinics claiming this, claiming that. And so you have to, about going back to responsibility, you mentioned it early on in the podcast, is you've got to take that responsibility to do a little bit of research yourself, perhaps, and actually work out, right, who's done a lot of content out there that seems to be well researched, who's talking in a way that I can kind of relate to. But I would say one other thing is, like, there's a human instinct to want a quick fix, and that's not just on the patient end, that's also the doctor's end. So for a doctor, for example, you see a red blood result, and it's wonderful if you think that you can just reach, let's say, for an AI, and that will just reduce the estrogen back into the green, and you think that that's doing the right thing. But that lacks that awareness of the underlying physiology and, you know, all of the detail about the reference ranges. So there is a human instinct there to want to change a red to green. And I don't think, you can be sort of like overly negative about that. But, sometimes it is they think they're doing they obviously think they're doing the right thing, but it just lacks that underlying knowledge, I would say.
I use a method which I've coined up over the years where it's called the one method, where it's own it, nourish it, elevate it. And we can even be guilty of, in the functional medicine world, where there's protocols based on supplements and then there's loads of commission from supplements. And if we're moaning about doctors giving all this medication, then we're doing exactly the same thing if we then go and sell loads of supplements. I look for, in that first own it phase, is that we draw a line in the sand of where you're at. We don't want you to get worse. What's happened has happened. Your health, your story has got you to where you are right now. We may use a few more supplements because we want you to get feeling good quickly whilst we're working on the underlying nutrition side of things. And then we start in the nourish it phase to pull some of the unnecessary supplements for long term, because supplements, most of them aren't necessarily going to be for long term. We work on the nutrition, and then the elevated phase is how we look at what we call 4 seasons health. Of that every season, people then quit now. We're getting into October. I can't do it until after Christmas. We've got a quarter of the year left. If you're in business and you quit for a quarter of the year, you're not going to get very far. And every single time we have to make sure we have health for 4 seasons. And when you actually say about that, I posted a picture yesterday, feeling nice and pumped in the gym, as you do when you get that, you get some blood in the muscles. And my mate's like, mate, you're looking awesome. And my TRT has been the lowest dose that it's been for a long while, literally 20 milligrams a day. And it's getting me into the mid-20s. And I feel really great. But someone commented saying, oh, you must be on high levels of gear. I'm not. And it made me realize is that I'm in better shape now than when I actually used cycles years and years and years ago. Physically, mentally, okay, I'm not as lean as when I competed in bodybuilding, but I'm much healthier. Is that it isn't necessarily the high testosterone that builds the muscle that people think. It's the right training, the right nutrition. And I always say about 3 things is that we need nutrition to optimize our gut for absorption. We need the right sleep to make sure we're recovering. And we need the right training for cardiovascular fitness and for strength. Then we can get healthier. And there's this misconception that more is better on testosterone. Have you seen that?
Oh, yeah, absolutely. I mean, personally, for me, like if I've been too, quote unquote, too high for myself in the past, and I didn't feel as good.
Yeah.
So there's a degree of honesty there as well. Some guys can tolerate it really well. And, the thing about testosterone is the more you take, generally it's more anabolic, but it doesn't make you feel better per se. The rest of the receptors are saturated. But you're absolutely right, because how many guys, I know people historically and currently who have taken anabolic steroids and they don't look like they particularly lift weights or train. And it's because they've not got the other things dialed in. Like similar to you, I'm in, very decent nick at the moment. And, that's 5 years on TRT. But what's changed over the last year or two is just being more dialed in and consistent with regards to the lifestyle aspects of it. Like you said, your training, your sleep, your nutrition, all of those things. Men out there, a lot of men are taking TRT and they just look like normal guys, which is fair enough. The results come from everything else you do around TRT, particularly in terms of your aesthetics, but you can certainly get a great physique on a very reasonable, decent dose of TRT. You probably can't, to be fair, step on Mr. Olympia and be like, 200 kilograms of pure muscle.
Yeah.
But then I don't think there's many of us who want that. That's not really a target. So yeah, I think you're absolutely right. That's what's so key is getting everything out, all of your other ducks in a row. And that's where actually, like we spoke about in the last podcast, is if you're on TRT or not, you've really got to be ticking those other boxes to consistently feel well, look well, look good, all of those aspects. It's about the whole picture rather than just jabbing yourself with testosterone.
I think as well, you made a good point there about, as we say, getting everything sorted. And it's not just about physique. Where testosterone has got this historical, it's about building muscle, it's about being jacked. It's anabolic steroids at high levels, yes, anabolic steroids as we know, and cycles and so forth. But testosterone is vital So estrogen is vital as well for men's health, but testosterone is very, very vital for men's health. And we're seeing lower numbers than ever. And as we've seen, higher suicide rates. And it's worrying that people, in my eyes, and maybe it's something that we all have to do better as being in the industry to talk about it more, that people are still seeing it as just the muscle growth hormone or muscle growth drug, shall we say, rather than thinking, I'm feeling low, I've got no sex drive, I really do not feel myself. Maybe it is testosterone, and maybe I need to get checked.
Yeah,
They go to the
100%.
doctors though, it's and they're not actually able to get checked for a lot of the times.
Yes, yeah. That's the irony of what we're saying. Yeah, there's so many kind of, there's societal barriers, and then there's actual genuine barriers when you do see your GP sometimes. But yeah, I mean, I would say, TRT does offer some anabolic benefits compared to even having naturally good levels of testosterone, because the level is consistent. Doesn't matter, your testosterone level won't be impacted if you don't sleep well, if you're ill. It's just constant from, let's say, your injection or your cream or whatever you're using. But that's not why we're taking it. We're taking it because we didn't feel good because of our low levels, and now we feel better. Now, we don't feel great every day because we're on TRT. There's a lot of other aspects of our life that come into that, like you said. But without the testosterone, we would feel pretty constantly rubbish. So that's the difference it makes. It makes you able to feel good again, assuming you're doing predominantly the right things. You don't have to live like a monk. None of us do. But, you have to tick the boxes in general. And that's the big difference. I think that's what people are key to understand is being on TRT doesn't guarantee you're going to feel great, but it gives you the capability of feeling good if you're looking after yourself well and other health issues, for example, are being taken care of. But yeah, I think it's got very little, when you're talking about TRT, very little to do with muscles and things. It is just generally well-being and probably long-term health as well. So it's a shame. I think it, like you said, a lot of this comes from the bodybuilding world because taking loads of testosterone will help with muscle if you're doing weights and things, but that's not why TRT's out there really.
Yeah, and getting back to that quick fix, maybe take a pill society that we're in, which we're seeing the uproar when Manjaro prices went up, and all this sort of thing about, as we say, taking responsibility for our health. And yeah, there can be some benefits for these medications, for these drugs, for these substances. But one, we don't want to abuse them. And two, we have to get those foundations in place. I'm seeing people as well that have come to me on Manjaro and their hormones have literally been screwed because they've potentially had low testosterone beforehand. I've kind of gone off topic on Manjaro here, but they've had potential low testosterone beforehand, high estrogen. Historically, historically, there's not really much history with that sort of medication yet, but these people have been higher body fats, and then there's more aromatization into estrogen, potentially low free testosterone, and they're then having severely, severely deficient diets because of so low calories, slower gastric emptying, which then potential more irritation of the stomach lining with less nutrient absorption in the long run as well. That I've seen people where the only thing I can see which has crashed their testosterone, which at first seemed better, and I put a post out, I think it was today or yesterday, and I put the same stuff on TikTok as Instagram. I'm not really concerned about TikTok, although that steroid one got so many more views on TikTok. I was like, yeah, awesome. But this one about Manjaro was saying, oh, my bloods have not done that. They've got better. And they get better, and then they've dipped because there's only so long the body can deal with that high level amount of stress of being in a severe calorie deficit. And then afterwards, there's the absorption stuff. Have you come across anything like that in the clinic?
I've certainly seen, so sort of not Manjaro. Well, it's exactly the same concept. So like you said, if someone's in a calorie deficit for a prolonged period of time, that is basically like putting the body under a prolonged stress period, which inevitably is going to, well, not inevitably, but is very likely going to have a knock-on effect on your sex hormones. I liken it to, psychological stress, illness, chronic disease. Chronic dieting does put a stress on the body. So if you're letting your, calories tank for a prolonged period of time, eventually, like you said, your sex hormones are not going to like that. Because if you're in the wild and you were starving, struggling to find food, it's not really the best time to make a baby. So that's how the way I liken it to people. So our bodies are adapted for, living in the wild. So we have certain sort of circuits that switch on or off or down regulate. But yeah, certainly this is what's so key is, and I think we said it last time in the podcast. I think Dave made a good point, is that in a way, a lot of us do have a reasonable, valid argument to behave as if we've been victimized when it comes to testosterone, because it's hard to get access. There's a lot of sort of inappropriate rhetoric against it, like you said, about it's all about muscle and things like that. But actually, even if you have an argument to say you've been a victim of X, Y, Z, it doesn't help you improve the situation. You've still got to grab the reins, take responsibility. And in situations like that, that's what's so key when you're trying to diet, when you're looking at things like Manjaro, speaking to someone who's not just selling it, let's say, they're actually wanting to get the best results for you. So whether that does involve any pharmaceutical agents, and you'd include TRT in that, or whether it does involve, like you were talking about, proper, consistent lifestyle changes. And that's why I love coaches and things, work with coaches, because they can literally follow day-to-day routines for patients and say, my guys, it's just kind of like, right, this is the calorie steps. Let's see how you respond to it. Is there any diet? I don't necessarily know if I love the word dieting fatigue, all of these aspects. So you can monitor that and keep it dialed in over time. But yeah, just always be bit careful if someone's selling you a prescription without giving you too much information about it as well.
Ironically, that's what actually happened on my wife's side when it came to going to our baby's first 12-week check. And the doctor, they weren't selling, but they were like, do you want HRT because you're 42 and just had a baby? Where's the blood work from that? And side note with that.
Yeah.
So
that's odd. That's odd as well, because usually even with HRT, it can be hard to. It's a varying bag with that as well, isn't it? Some women really find hard to get HRT. That's just randomly off the cuff. Just, do you want HRT?
And as well, testosterone for women.
Mm-hmm.
Now, when you were in NHS side of things, I suppose there wasn't much testing for testosterone for women.
No, it was just coming in before I left. There was just a bit more talk about it. But even back then, it was very much so, as a GP, you were kind of advised to write to a gynecologist about it if women were pursuing the idea of testosterone, which is funny because, unless you're going nuts on testosterone, it's not really it's seen with a lot of skepticism and fear about testosterone, which is largely inappropriate, really. But yeah, there was a lot of sort of hesitancy to prescribe it. But like you said, that is improving over time, which is good to see.
Yeah, that's good. That's good. Now, we've been through a few different things on this. Are there anything that you want to come across, anything that you've seen clinic-wise or anything like that you would love to just speak about the last couple of minutes at all?
I think rehashing that idea that if you're worried you've got low testosterone and you're thinking, for example, of doing it yourself, which, neither of us are big fans of at all, but you've got to get blood work done before you go on it, because there's so many other things that can cause symptoms like low testosterone. There's lifestyle factors. There's stuff in the blood that you can see that, could be correctable without TRT. So that is so key to it. But also, if you think about something as major as testosterone, because it is, it's an intervention, it's shifting your hormonal system, putting it in the hands of your injections or whatever
It's lifelong as well,
using.
right?
Yeah, and it's best to consider it lifelong. So is that not worth putting, a bit of time, bit of research, and maybe putting in a bit of, money to get the best, get the best treatment, get the best assessment, get the best long-term outcomes? Because at the end of the day, you're investing in not just now, but because, like you said, it's lifelong, the future as well. So I think that is so key to get across to men.
Yeah. And you can find private labs. You can go to Alphagenics, then you guys do the labs as well before. And I would also put my name to it with regard to the reputation that I've built over the years, is that I would put that on the line to say Alphagenics aren't going to prescribe you something unless you absolutely need it and just sell you into the plan as well.
Yeah, well, I like to look at it as if it was myself. I said to a guy, recently. I said, well, it's literally, the other day was saying, if it was me, I'm on TRT, but I didn't really have much choice in the matter with the levels I was at and the causes. But speaking to a guy whose levels weren't great, but I said to him, honestly, if I was you, I wouldn't go on TRT right now. What I would do is over the next, 3, 6 months is really dial in. And we went through, lifestyle, all that sort of stuff and said, let's see, because the best case scenario is you feel better, your hormone levels improve, your general health markers improve, and you don't need to go on TRT. At least you can delay it for 5, 10 years. That's a great outcome. And yeah, it's not great for the business side of it, but it's good because you're doing the right thing by the person. And for me, I always think, right, well, if it was me, I'd love to not have to inject, or I'd love to
Yeah.
not have to do this cream daily. So I think ultimately looking for people, like you said, like yourself, looking for people who want the best for you, and they get almost like your business relies on you doing a good job rather than you selling X, Y, or Z in a sense.
It's interesting you say that about when we talk about you go away and do these things which potentially could increase your testosterone anyway. But even if you get on TRT, to have the minimum chance of big side effects, you still have to do those things. So the best case scenario is you improve your testosterone and other markers to feel really great and don't need TRT. The worst case scenario is you've invested this time, so when you get on TRT, chances are you're going to see effects in a much more positive manner anyway.
Exactly.
So
Yeah,
it works
exactly.
well. Right. Can you just remind the guys where they can get hold of, if you're on social media, if it's better to contact you for Alphagenics? Can you tell the guys how they can get in touch if they want to chat with you?
Yeah, absolutely. So it's alphagenics.co.uk. Also work for Atlas Laboratories. It's going to be, I think the website's changing to atlas.co.uk soon. But if people Google Atlas Laboratories, they'll find it. And Instagram, I'm on Instagram and LinkedIn as well. So just Dr. Max Draper, basically, you'll find me.
Cool. Well, appreciate you giving the time once again, and hopefully we'll get some more episodes. Maybe we can dive into some of the other tests that are available other than bloods to look into, since you've got the Atlas side of things. I know they do Dutch and things like that. So looking into that, foundations and so forth. But appreciate you being here.
Pleasure. Thank you.